It says that's what this is about, correct?
Absolutely. The whole push of this is that exact population of, I'm married, I've got a child or two, and I just, I'm self-employed and I can't afford the health insurance coverage that I should have. Or I've got a plan, but it's so expensive that basically I can never meet my deductible because I've got a $10,000 a year out of pocket, whatever the case is. It doesn't hurt to look around and say, for myself and my family, my dependent or my partner and our two dependents, this is what I currently have. But if I went through the exchange, wow, I could get it at this, and I could maybe lower my deductibles because I could either go with the bronze plan that has a high deductible and a lot of out of pocket, or I can move up into the silver plans, which has a lower deductible. So, I still may be on the hook for the first initial costs, but at some point there's sort of a stopgap where you're protected and you don't have these massive out of pockets. And of course, you can move all the way up to the platinum level.
If you live in this country, but you're from another country and you're not a citizen of this country yet, but you're working here and you're planning on staying here, is there anything in this where they can apply for this type of insurance?
I believe right now, my understanding is that this is geared specifically for U.S. citizens. Now, obviously, as a policy matter, it's the discussion about how much can you cover and who can you cover. And you're also trying to get it through a political process where that would, in all reality, that's a hot button topic of, are we going to now provide for lack of a better term, even subsidized tax care or health care through tax systems to people who aren't here as a U.S. citizen. So this is really geared towards U.S. citizens. And let me just mention on that line, what happens is, so Michael Harris goes on the exchange, I report my income, I then get a what's called a tax credit from the U.S., which sort of looks like a subsidy, but it's not quite, and I'll explain why. What happens at the end of the year is when I report my taxes through my tax filing, then my income should match up with what I reported on the health exchange. If I got a pay increase, I may owe some of that money back, and that will be done through my taxes. So if I'm getting a refund, I may get a little bit less of a refund. If I owe taxes, I'm going to owe more taxes. So it's important that people that go through the exchange and report their income and then get these, that's why it's called a tax credit, because the federal government is saying, basically, we're going to help you with your premium, but when you file your taxes, it's going to all come back into